Hi, everyone. My name is Tessa Verhoof, and as Joe mentioned, I'm a proud board member on the Coalition for Clean Air, but I'm also a principal on the sustainability team here at Blue Shield of California. I'm just so excited, truly, to be introducing today's webinar, which will explore how air pollution and climate-driven challenges in California are reshaping healthcare utilization. I'm really grateful to the Coalition for Clean Air for inviting us, Blue Shield of California, and also for inviting Milliman to join today's conversation to talk about the recent study that these two groups worked on to look at how extreme heat and poor air quality can impact how we consume healthcare in California. At Blue Shield of California, it's clear to us that the environment is a driver of our health. When we experience things like bad air, extreme heat, that reflects in our health through respiratory ailments, cardiovascular impacts, brain health impacts, and much, much more. Extreme heat and poor air quality are not just environmental issues, they are public health crises, truly, that disproportionately impact vulnerable communities. And in some very extreme cases, we've also seen that extreme weather events can impact our ability to obtain care. As you'll see in a slide that Nicole will show up, um, we'll see how in 2018, the Camp Fire in Paradise impacted that community. And the photo shows how Feather River Hospital had to evacuate their patients and supplies. And you can see kind of all of that there. And in the backdrop is just the haziest sky. But we also saw this more recently with the LA wildfires that occurred in January. The next photo that Nicole will show shows patients that have been transported, evacuated rather, to the Pasadena Convention Center. So these climate issues are incredibly real to the healthcare sector. In fact, the National Resources Defense Council estimates that pollution and climate change are adding up to 820 billion in healthcare costs annually. At the same time, we also know that the healthcare industry is a contributor to our nation's carbon footprint at 8.5 to up to 12%. Healthcare organizations are in the business of doing no harm, and supporting a healthy and thriving environment for all is crucial to that mission. At Blue Shield of California, and as one of California's largest health plans, that means we too have to actively work to reduce our own emissions. As a result, we've committed to science-based targets, which are a rigorous set of standards within the sustainability industry to help organizations set targets that drive climate action. We are also measuring and actively addressing our climate-related risks. We are working to build climate resiliency to better protect the health of our members, but also of communities within California. And we are doing what we can to convene, lead, and collaborate with others across the industry, because we know when it comes to climate change, we're not competitors on this front. We have to come together and solution together to support the environment and to support public health. Air pollution and wildfires and extreme heat have become an unfortunate everyday reality for us here in California. They affect every facet of life, especially health, and as climate change accelerates, the urgent need for comprehensive data becomes increasingly more important. And the need for proactive mitigation measures is becoming increasingly clear. And that's what really drove us at Blue Shield of California to work with our partners at Milliman to put together this study. Because while there's a lot of literature out there detailing how climate events can impact health, there is less research available around how these events specifically impact the healthcare system itself and healthcare utilization in particular, and how it intersects with social determinants of health. So to kick off today's conversation, I'm going to pass it on to one of our key researchers, Dr. Rong Yi. As Joe mentioned, she's a principal at Milliman. She will provide high-level overview of our study findings. That will be followed by the Q&A with Dr. Joe Liu, Dr. Jennifer Nuovo, or Chief Medical Officer at Blue Shield of California's Promise Health Plan. So I will pass it on to my partner here, Dr. Rong. Take it away.
Thank you, Tessa. Hi, everyone. Thank you for being here. My name is Rong Yi. I'm a health economist by training, and I have been, I guess, in this business for over 25 years. It's my pleasure to be sharing the study results with you today. I think we started with this journey a while ago. It took us quite a lot of time to to put the data together, but we really started out asking maybe a simple but really important question, which is how do extreme heat and poor air quality impact healthcare utilization? So impact the way in which the Californians use healthcare. Next, please. Next slide, please. Right. So the component of this study, um, sorry, one slide back. The component of the study, I think in a technical term is that there's a lot of data that we put together and we follow people longitudinally. So basically, of the 40 million or so residents in California, we put together a data set of about 1.4 million insured Californians. We looked at their healthcare utilization from 2017-18 to 2019. It was a specific decision that we made with respect to the time series. As we know, in 2020, probably through the end of 2022, the entire world was in the pandemic mode. So healthcare utilization was just kind of the patterns were disrupted. And so in order to get a clearer picture, we moved the horizon before the pandemic. Again, this was a pilot study, and we're interested in expanding the scope. So in the study, we focused on two very big climate issues that we feel every day as individuals. So one is extreme heat. However it's defined, there are different methodologies. We used a relative methodology, so which is we look back a historical period and established a baseline, and we selected a cutoff point to say that if the temperature, the highest temperature in the day, is greater than the 90th percentile of the historical period, the baseline period, then we would deem that as extreme heat, and then we counted the span of the heat wave, and then counted the frequency and allocated the days and the frequencies geographically. On air pollution, which is the other climate event that we looked at, we specifically counted through three types of pollutants: PM 2.5, PM 10, and ozone. And then we merged these daily climate events, geographically indexed, to what we call healthcare administrative data, or in other words, healthcare claims data. That's the data set where health insurance companies typically collect from the providers, healthcare providers. It's on a daily basis for all the population that's insured. Say Rong had gone to the doctors, a doctor would write down a data service for me, a medical diagnosis, a procedure in which those are all codified, and also the prescription, and I might get a referral, and I might get hospitalized, and so on and so forth. So those transactional details are called claims data, that's captured by health insurers, and that data is also carrying date and geographic information, for which we then integrated with the climate data. And the third dimension we also integrated is social determinants of health, which I'll get to in a little bit. So basically, we put together almost like a large or big data, not only about health or healthcare, but also about climate, and also the community socioeconomic characteristics in which people resided. And then we went into looking to look for patterns. The specific patterns or healthcare utilizations that we looked at included things like counts of doctor's visits, ER visits, visits to urgent care, hospital stays, allergy tests and treatments and so on. And the goal really was to see how the environment shows up in people's health and healthcare use. Next slide, please. So the high-level findings, I want to preface by saying that the findings are very, very complex. It probably would take a much longer conversation for me to really delve into the details. But the big picture is that it's not surprising that climate really does change how people use healthcare. So as an example, on bad air quality days, people would go to the doctors or urgent care a lot more. So sometimes as many as 25 extra visits per 1,000 people. So in healthcare, or in healthcare management, we tend to have these measures, standardized measures. So we use the denominator per 1,000 insureds. So we're observing about 25 extra per 1,000. So if you multiply that out 40 million times that percentage rate, and it's a lot higher. Of course, this is not 40 million, is not evenly distributed all by air quality, but that's kind of a rough way of extrapolation at the population level. The other thing was that heat had an effect as well. It's probably smaller relative to from a magnitude standpoint, relative to poor air quality. It's causing about like 5 extra visits per 1,000. So in other words, both matter. So both poor air quality and extreme matter. But the catch here is that dirty air tends to hit harder and faster, I guess. Next, please. Okay, so here we're looking at is really a highlight of what we call like socioeconomics becoming a magnifier or matter in the sense that it exacerbates the impact of poor air quality and extreme heat on people's health and healthcare utilization. So, or said differently, climate risk play out differently by depending on where you are, who you are. That's I guess it's not surprising. In healthcare, we have always observed for many years that there's this socioeconomic aspect that affects how people perceive healthcare systems, whether they trust the system or not, how people utilize and access, and there may be language barriers and so on, and how people then would take the advice from healthcare providers back home. Are they compliant or not? And so controlling for how care is delivered, socioeconomics matter a great deal in healthcare. So we're layering on top of like the traditional view, then we're adding in this new dimension, which is climate, and it's basically playing out in a similar way. So we're seeing kind of the band in which socioeconomic can actually move the dial. So either by adding or by reducing. So as an example, so let's take crowded housing as an example. I'm not sure if that's pointed there. Okay, so what we saw there was that during bad air pollution, people living in crowded housing had far more urgent care and doctor's visits than others. So that's so sometimes it could be more than 100 extra visit per 1,000 people. So in other words, 10% increase. That is a very significant impact. So to play out further, for urgent care centers and physicians' offices who are located in these lower socioeconomic areas, in the presence of bad air pollution, their expected healthcare utilization visits will be a lot higher than other places, like as much as 10%. So that is significant. So further down would be there may be crowding, there may be difficulty in accessing care for these people who needed it on a timely basis. So this really tells us that climate and health are not really separate. So the environment and the social circumstances combined could shape risk, could magnify or shrink risk, I guess. Next one, please. So we have some, I guess, some additional findings. So for example, we observed like time patterns. Right. So it's when the impact would hit. So for example, pollution would hit right away, but heat tend to show up months later. And then the broader impact would be, so, why does this matter? So how do we think about this? So we know, we observe, we feel it, that the temperatures are rising, and California in particular encounters a lot more frequent and severe heat and air pollution events. So this is probably, I'm in Massachusetts, but I've visited California enough times to actually feel the changes over the years. And then the vulnerable populations are particularly susceptible. As I mentioned, not everyone in the presence of risk, not everyone is equally protected. So for communities that are vulnerable, what are the mitigation methods or approaches, and what is the role of the healthcare insurers and healthcare providers? Those are all very, very significant and profound topics to discuss. I think that what we have observed is that climate is a risk to health insurers. It's a new dimension, adds up to a kind of from an actuarial and analytic standpoint, as to variability that health insurers should be taking a look at, or should be incorporating in their actuarial and analytic practices. And so again, we're only looking at this in a kind of a pilot study. So there are many other dimensions in which healthcare delivery and healthcare outcomes that ought to be modeled, that we haven't modeled fully. And we certainly, there's one other limitation in our study, is that we only looked at the interaction or socioeconomic interaction with climate and health in a kind of a high granularity, not very fine, not very finely done. So we look at things at the county level. It will be a lot more meaningful if we can look at smaller geographic variations. And there's a lot more research that's needed. So for example, taking the January LA wildfires as an example, it actually has been disruptive. We have not had the opportunity to study a traumatic event like that and have it played out several years down the road, and see how that might impact Californians. So long story short, we found climate to have material impact, and it has made a difference in how people seek healthcare, and the differences are playing out differently by socioeconomics. I guess with that, then I'm handing it off to Dr. Nuovo.
Joe, you're on mute.
I'm sorry. We're gonna do the panel discussion now. So thank you, Dr. Yee, and we're gonna ask Dr. Nuovo, the Chief Medical Officer of Blue Shield California Promise Health Plan, to join us. And remember, everyone, if you have questions, please put them in the chat. And if you see questions you like, please promote them so that we'll get to the ones that are most popular. Dr. Nuovo, is there anything you'd like to say based on what you've heard so far?
Yeah, I think the study is really impactful and really starts us on a journey to better understand how climate, how weather events, and certainly how these fires are impacting humans and what we can do about it. Clinicians see the impact of the fires and the heat, every day in their practices, and have some tools, medications, for example, in their toolkits to help. But having a better understanding of your entire practice and who's going to be most vulnerable, who's going to be most exposed when there's a heat event or when there's a fire, I think can be very helpful to the clinicians. And also the impact of utilization, so visits to your office or things that you are asked to do early on, as well as being able to continue and revisit that person or those people that were impacted by the event later on to ensure that they're continuing to improve and stay healthy because of the next event might be coming. So I think it's really helpful from this study, the early impact, and then also that there's going to be a later impact.
So the research showed that populations with social needs we're experiencing both higher and in some cases lower healthcare utilization, depending on the type of care needed and all sorts of other factors. It also revealed that the impacts on utilization could last for months. So as a clinician, can you help explain what might be going on there?
Well, I think people with more money and in neighborhoods that have trees and have green spaces, those are families that often can afford a HEPA filter. They can filter the air in their house. They have air conditioning, which again filters out the pollutants. If you are living in a crowded environment or in a apartment housing that does not have air conditioning, you can't afford to run to Walmart and buy a HEPA filter. It means that the impact on your lungs is greater. And then we also know that our low-income populations are also the people that we expect to continue working during heat events. So it's not uncommon. We're here in California, we drive up and down the roads. We see people in the fields when it's 110 degrees out, 100 degrees out. And so those of us who insure that population are really trying to work with employers on how can you protect your employees during severe heat events. For example, I can work from home when it's 100 degrees, but other people can't necessarily do that. And it's our expectation that there'll be somebody at that 7-Eleven if we need to run in and get a slushie, right? But that person may not have the ability that I have to protect my lungs in the same way. So I think we can see the greater impact immediately. And then obviously, if we're exposing a vulnerable population or already maybe a chronically ill population to more pollution, we in the clinical fields have to think about what's the impact on that person's lungs 6 months from now, a year from now, 5 years from now, screening for lung cancer, for example, looking for evidence of asthma and COPD. So those are some of the ways why we are particularly worried about our vulnerable populations.
Thank you. Dr. Yee, has there been any other research on this issue? And if so, what did they find?
I think that's a great question. There actually has been a lot of studies, especially in the field of environmental health, that looks at the impact of specific events on hospital admissions or ER visits. But I have not seen things that are so, I guess our study is unique in that we actually looked at insured, using claims data, looking at many different types of utilizations. I think what sets us apart a little bit is that we look at healthcare from a payer standpoint. So payers look at not just ER visits. We look at all sorts of services. Healthcare is more like yes, it is event-based, but one event triggers another. So it's always sort of a chain events. Something bubbles up here, it doesn't stop there. It has a broader impact. So that's why looking at some things more holistically probably is more useful for healthcare insurers. So that's, I guess, I hope that answers your question. That it's been looked at.
Yeah.
We're somewhat unique.
It does. It raises a question for Dr. Nuovo. I mean, why does Blue Shield do this kind of research, and what kind of takeaways does the research have for insurers and health professionals in the public sector?
Yeah, I mean, I think from the clinician perspective, you react to what's happening in real time. People are coming in your ER, you're going to see them and take care of them. People come in your office 2 months, 4 months later, you're going to take care of them and do the best you can for them. From the insurance perspective, we can kind of look at utilization or use of healthcare resources over time. And one of the disruptive problems for health insurance with these increased number is that it's very hard to predict what utilization is going to be. We may have in the past been able to say, okay, this is the kind of utilization we expect from this particular type of employer. And so this is what insurance is going to cost you next year or the year after or the next 3 years. And also to look at our hospitals and our doctors that we pay and say, this is what we're expect to pay you for these next 3 years. The more disruption we have, either with weather events, with fires, with floods, with tornadoes, with hurricanes, it becomes much more difficult to predict and really throws the economics of healthcare a little bit tossed up in the air, a little bit like a tossed salad. So Blue Shield and I think other insurers will hop on board as well. We get very interested in trying to figure this out so we can be proactive, not only to keep people healthier and to give our providers the tools that they might need, but also how do we predict how we're going to be able to provide insurance over the long run.
So yeah, you mentioned economics, and along those lines, where Coalition for Clean Air plays a lot is in the policy making field and in the weeds and that sausage making factory that ends up creating policies in California and regionally throughout California. And everyone seems to be just focused on affordability these days. It's all about affordability. And that affordability question seems to be very narrowly focused on, the cost of eggs or the cost of gasoline and things like that. What I'm not hearing is a broader conversation about the cost of a lost day at work because you're taking care of your kid who has an asthma attack because the kid was breathing polluted air. So is there a role for all of us to play in broadening this conversation when it comes to affordability? And that's for both of you.
Ron, you want to take that first?
Sure, I'm happy to. Trying to put on my health economist hat. And Joe, I think you meant this is healthcare is health. Healthcare is not one individual. It's it's a family, it's a community. Unfortunately, our study is such a narrow focus. It's only on healthcare utilization, but you're absolutely right. So like loss of productivity is something that actually can be quantified. We try to, for a different context, we actually helped with the National Resources Defense Council try to estimate the impact of extreme heat on loss of work for workers' comp purposes in North Carolina. The data was not great, but we found some evidence there as well. So I want to say that it's, when you look at the data, if we have the data, I think we'll be able to find the evidence there. Now, the question is, how do we put this all, quantify the economic loss? So far, we're only looking at insurance loss, not economic loss. And that is, there are established methodologies to estimate that. And certainly, as a kind of economist, econometrician, I think we're set up to actually do that if the data is there.
Yeah, and I would just add that at Blue Cross Blue Shield, we did a employee climate survey recently, and 80% of our employees, and most of our employees are here in California, as you might imagine, 80% of our employees said they have been impacted by climate events. 58% said they are having health impacts personally, and 57% lost productivity due to disruption. So power outages is the most common one, but also being asked to evacuate, also having, personal or family respiratory issues because of air quality. And, recently we found during the Los Angeles fires in the winter, we kind of had all hands on deck. Everybody had to show up. Everybody had to be on the phones. Everybody had to be helping in some way because it impacted so many of our members. But we also found that we had employees who lost their homes in the fires. We had employees repeatedly asked to evacuate or to be ready to evacuate. We had employees working from Starbucks, working from hotspots that the power companies set up for them, just in order to keep on the phones with our members. So it's very hard in really almost any industry that you can think of to keep to keep the lights on, to keep the work going when your employees are so impacted also by what's happening.
Yes, and that has a direct impact on affordability, right? I mean, it just seems it's directly related to what all of us pay, and what lack of productivity results in higher costs and all of that. The study showed that there were larger, more significant variability for poor air quality than extreme heat, and there was a tendency for sometimes months-long delays between exposure to extreme heat and air pollution and the need for healthcare services. What should we be taking away from that?
I think
go ahead, Ron.
Go ahead. Sorry. Do you want to go ahead, and I can probably come behind?
Well, extreme heat, most cities and really most areas have come up with some mechanisms to help with extreme heat. They set up cooling centers, their water distribution places, that sort of thing. And extreme heat may last for several days, but it does not last for weeks and months. And most people can get inside. We do worry about our unhoused population or people that are crowded living situations, but extreme heat in the short run seems to be handled in a community way. I think the air pollution is a much bigger beast to try to solve. There are immediate asthma attacks, of course, but the impact on your lungs over time from this exposure is dramatic and really unfortunate.
Dr. Yee?
Yes, so I think with the models that we have today, with some refinements, if we can tie the populations to, say, clinics, we would be able to actually forecast out at which time period there might be additional surges needed or additional care needed, where and when. So that's kind of the power of analytics. That's my addition.
Better living through big data. You did do the study. You had to go back before COVID to the 2017 to 2019 period. If we were to do the study again now with more recent data, would you expect to find any different results?
Probably not. I think that we actually had tried for a different research project looking at pre-pandemics, starting from 2017 all the way to 2023, but asking different questions. So how has heat and pollution impacted morbidity, so disease prevalence rates, such as respiratory conditions, cancers, mental health, and cardiovascular, circulatory conditions. So the findings are to be released later this year by the Society of Actuaries. And so again, with the payer perspective, the materiality is very significant. So I think if we were to repeat using more data, it will be the same, probably even greater, because we have seen greater impacts now.
So from what we know from the study and from your experience as a researcher and a healthcare provider, insurance provider, what should people be doing to protect themselves against the exposure to air pollution and extreme heat events?
And I just have to tell you, my dog Zoe is very mad about bad air. So
Yeah, we can tell. My dog, she left actually.
She has been letting everyone know that this is not good. She's a German Shepherd with a double coat. So, hot air days are
Not
like
good.
not her favorite, right? So anyway, I apologize for the editorial comments from Zoe. I think when it comes down to um, poor air quality, just watch the air quality indicators. They're available, readily available. Stay indoors on poor air days. If the air quality is bad, do not go for your morning 6-mile jog or 3-mile jog. If you need to go outside with Zoe, do it at a walk, not a jog, so you're protecting your own lungs. You can visit California Clean Air Center, which has some resources also to help you. Use air purifiers, use humidifiers inside your home. You can block gaps that you might have in your windows or your doors. And of course, even with bad air, plenty of hydration, like clear your sinuses all the time, keep drinking. If you have asthma or you have underlying lung disease, touch base with your doctor. There may be some adjustments to your medication during bad air days. If it's hot, just drink water. Just drink water. Keep your space as cool as you can, or visit a cooling center. Avoid the peak heat of the day. So if you have to do chores outside or you have to be outside, try to finish everything up by 11 or noon. And then not go back outside again till evening. And then try to learn the signs of heat-related illness, right? Sweating, dizziness, nausea, all precede heat stroke. So they're all related to heat events, and making sure you get out of the heat if you're feeling any of those symptoms. Confusion, rely on people around you. If you act confused, someone should take you inside, call 911. That's a sign of heat stroke.
We always tell people that air pollution is not an equal opportunity problem. It more adversely impacts the very young and the very old and the people who have pre-existing medical conditions. I assume that's probably true with extreme heat too.
Yeah, and every year in California, we some children being left in cars while a parent just runs inside for a few minutes, right? And those cars can overheat very badly. All our dogs are all the Zoes that are out there, when they are doing their walks on hot pavement, just think about how hot this gets on their paws. So really being careful for everyone that you have to take care of. Watch your community. What's going on with your neighbors? Is there an elderly person that you can touch base with? We can't, in the medical community, know what's going on inside everybody's homes, but we can all have a greater sense of community and helping each other out during these events.
Okay. So before we wrap up the panel conversation and get to the questions, we should talk a little bit about Clean Air Day because it's coming up. Blue Shield has been a very strong supporter of Clean Air Day for many years. And if you in the audience, if you don't know what Clean Air Day is, please go to cleanairday.org to find out more. So Clean Air Day is an opportunity for you and all of Californians to come together and make a pledge to do at least one thing for clean air on the first Wednesday of October. How has Blue Shield been involved in Clean Air Day, and what do you have planned for this year?
You know, this is our 6th year of sponsoring Clean Air Day. And we have quite a lot planned through September internally with our own blogs, and then leading up to Clean Air Day on October 1st. We have an employee-wide pledge campaign, and we have at least 7,500 employees here at Blue Shield, and we're encouraging everyone to take a clean air pledge. Everyone can be a little have a little lighter touch on our environment and can do something to help environmentally through volunteerism. I also do a lot of work in the plastic space, so we really encourage our employees to clean up plastics whenever they can. And we also want really to see the train to reduce emissions as much as possible. We are still a hybrid work environment. We encourage people to work from home and stay off the roads as much as possible, but come together for community in the offices, you know, from time to time. And yeah, that's our commitment here at Blue Shield.
I hadn't thought about it before, but I know we have a lot of Blue Shield employees in the webinar today. We should have made it so you got credit for participating in the webinar today for Clean Air Day, but maybe we can remember to do that
Shout
next
out
year.
to everyone.
Okay, so what are the key takeaways we want people to remember from the study and from what we discussed today, and for both of you? Dr. Yee?
Sure, I was trying to unmute. I think that I would say it's all the findings are probably too intuitive to really be surprising. Number one is you feel it, it's actually there. We can see it in the data. It's healthcare providers have seen it, and it's also covered by health insurance. The data is there, it's obvious. The other is that the SDO, socioeconomics play as a, I guess, a magnifier. So it creates further inequalities in the presence of climate change. So that is also not a surprising finding. The reason is that we all know risk is one thing, isn't an objective measure, but then the protection is driven by the socioeconomic resources that you have. And then the third dimension is probably more subtle. Is things are still playing out as we speak. It's not that today is hot and then we had a lot of events and end of story. The impact is long lasting. So that's kind of my key takeaways to share.
Yeah, and I would just add that environmental effects, they affect our health in real time, and they affect our health over time. So we have both immediate impacts and long-term impacts. And to Rong's point, it is much more impactful on the lower income populations, on the very young, on the very old, people with chronic conditions. As we get more and more of these events and they become more severe, it's really important for us to continue to partner and do these studies so that we can continue to learn how best to both modify our environment, but also how best to impact the events on our employees and on our patients and members that are out there. We are really grateful for Rong and her team to partner on this study with us, and it really is a first step for continuing this work going forward and to continue these conversations.
Yeah, I'll have to say that I saw the study and I was really interested in the findings, and I contacted Tessa and I said, we really should do a webinar about this because it's really interesting. So I'm glad so many people joined us today, but we have some time to get to questions. And if you haven't asked a question and you want to ask a question, please post it in the chat. Brittany Rivas asked if we all have time for a HEPA filter or an air filter. Are you only supposed to use those filters with the doors closed? Asking because summers are rough and living in an EJ community where I do not want to open my windows if I don't have to.
You can use the HEPA filter with your doors open, your windows open, or your windows closed. You do want to have the HEPA filter where you are mostly in the house. So if you've got it in a back bedroom, but you're spending your entire day out in the, kitchen, living room area, that may not be as effective for you. And obviously, the more closed up your environment is, the better the HEPA filter will work for you, because just closing yourself in is really helpful. Hope that helps.
Okay. Other questions? I think Jordan helped me find the questions here. Okay. So the State Office of Environmental Health Hazard Assessment, OEHA, my favorite acronym of all agencies, is currently refining its Cal Heat Score mapping tool, wondering if there's room for cross-sector collaboration to integrate air quality monitoring into health-related public health warnings like the Cal Heat Score. That's an interesting question. Also, I'm not sure we can answer it, but the California Department of Public Health administers the Syndromatic Surveillance System, which monitors heat-related ER visits in near real time. This could be another resource to improve monitoring for heat and air quality impacts. Comments on those?
Well,
I think those are really good comments. Yeah.
Yes.
the
We get some
pointers-
quality people here on our webinars.
I think mapping, can be really helpful. The air quality scores are also really helpful. Sort of the color, orange, red, those things mean, just intuitive to us in terms of when we look at them quickly, or we don't have much time, but let me check quickly. And I think heat mapping, or just geo mapping can also be extraordinarily helpful to us. We live in a lot of different zip codes with a lot of different impacts from the wind and the air and all that. So I think the more visual that we can make these tools available to the population, I think that's going to help people protect themselves. Absolutely.
We should follow up. I mean, it would be great to know more about the Cal Heat Score and what OEHA is doing, and also about the California Department of Public Health's work on surveillance. I worked on some public health surveillance issues with when they were first getting started with their work at California Department of Public Health. I remember serving on an advisory committee. It was very rewarding. Lots of smart people on it. So I think if we don't have any more questions from the audience, we can actually probably wrap this up just a little bit early. And let's just do and do the panelists have any other closing comments they'd like to make? Dr. Yee?
No.
Okay.
Thanks for the opportunity.
No problem. Dr. Nova?
No, but I appreciate including us here on today's conversation, and hopefully this is impactful, and people are going to be able to go out and take a cleaner pledge and work a little bit in their own neighborhood and their own homes to both be personally safer and to have the community safer.
Yes, absolutely. Let's do just a real quick review. On the most basic level, exposure to extreme heat is bad. And in general, if you're exposed to it, you're more likely to end up needing healthcare services. And exposure to air pollution can be even worse. And so if you're breathing polluted air, you're more likely to end up in urgent care or an emergency room or being admitted to a hospital. And Dr. Yee and her colleagues found that it's not always that straightforward, however. For some subgroups and some exposure scenarios, you actually may be less likely to use healthcare for a time period, depending on the type of care you need and your circumstances. So there's potentially a lot of different explanations for that, including access to transportation, language barriers, whether you have no choice but to work instead of getting the healthcare that you need, and things like that we discussed. And I am very sorry to be the bearer of bad news, but the more people are exposed to air pollution and the worse the climate impacts, the more your health's going to be impacted. And air pollution and climate are already costing us an estimated $820 billion a year in the United States annually. So that stuff does add up. So In terms of action items before we leave you today, sign up for Clean Air Day. Take precautions to reduce the impacts of extreme heat and air pollution that you're exposed to, that you and your family members and friends are exposed to. And please keep attending these Clean Air Conversation webinars. We really do appreciate it. So we're going to wrap up. Thank you to Tessa and our panelists, Dr. Ron Ye and Jennifer Nuovo. And thank you to Coalition for Clean Air members, Jordan Brazil and Nicole Roberts, for helping with today's event. Thank you to Blue Shield for partnering with Coalition for Clean Air to make this webinar possible, for doing the study that would enlighten us about these impacts of air pollution and extreme heat on healthcare utilization. Thank you for attending and supporting Coalition for Clean Air. If you haven't made your Clean Air Day pledge, it's cleanairday.org. Just go and sign up. May every breath you take be a breath of clean air, and please stay safe and stay cool and have a great day. Goodbye.